Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan. I want to talk about some unusual cases. When I see a patient who's got unusual lesions, gum tissue, I'm typically in these cases finding something interesting in the past, almost always interesting in the past. And typically these people have been exposed to one of two things, either strong volatile fumes, like from gasoline or other vapors. They may work in a chroming plant where the vapors from the acid they're exposed to, but very often it's typically people who've had asthma when they were younger. And when you have an inhaler, when you use the inhaler, you're supposed to rinse your mouth out afterward. And most of these people have used the inhaler and not rinsed their mouth out. And it takes about 20 to 30 years for problems from these various chemical fumes to manifest in the mouth. And I'm finding that the symptoms are very bizarre. So for instance, here's a case. It looks like there's a hole here, but the situation with this person was, woman, the gum tissue is so delicate, so tender, so friable, that we just went to remove some saliva in this area with a gentle suction, and a blood clot formed under the tissue. You can see how red this tissue is with these unusual lesions or sores here. This is that same case, and again, you can see the red tissue here. It's just chronically inflamed and bleeds very easily, and it's very, very sore. When we examine the tissue, blood poured out from between the teeth. And again, because that tissue is just so fragile, shall we say, you just touch it and it bleeds, and it's very painful to the patient. And again, this patient years earlier had been exposed to chemical fumes that didn't really manifest the damage until 20 and sometimes it's 30 years later. This is still the same case. Here we see this lesion here and inflammation all along, blood coming out from between the teeth. So here's the next case. This doesn't look too bad, does it? Just a little bit of white irritation here. And this patient is an interesting case. When she was a child, I'm talking about 30 to 40 years ago, many years ago, for 8 years she had asthma, and she used an inhaler and did not rinse her mouth out. You're supposed to rinse your mouth out. And I'm finding a lot of these cases. People have had asthma, used an inhaler, didn't rinse their mouth out. 20, 30 years later, 35 years later, we're finding these things are happening. I'm finding these things are happening in the mouth. This is the inside of her lip. This is all blistered. This is all sore and raw on the inside of her lip, and this is around the gum tissue. And again, if you look at this tissue, it's just chronically painful. It's red, it's sore, it hurts. This is not typical gum disease. It's not typical periodontitis. This person would probably go somewhere and they wouldn't know what it was. They would know there's blisters, there's pain, they might give it a diagnosis. But what I'm finding is, in almost all of these cases, there's a previous history of exposure to strong chemical vapors, fumes, or inhalers, especially if one hasn't rinsed out afterward. Now, here's another interesting case. In 1998, worked at Selfridge Air Force Base next to where they fuel the jets. And 2 days a week, all day long, where she was working, the fumes from the jet fuel came into that building. It was not air conditioned, so the windows were open. The jet fuel odor came in, the fumes, and she smelled them the first time, and she was alarmed, but she really didn't know how dangerous they might be. For 4 years, 2 days every week, for 3, 4, 5 hours, she was exposed to the fumes from this jet fuel. Now, 30 years later, well, 25 years later, something like that, we're seeing these lesions appear, and they hurt, they're painful, and she has no idea why. I said, well, have you had anything else going on? She said, yeah, I was diagnosed with rheumatoid arthritis about 7 or 8 years ago. She said, nobody in my family has autoimmune disease. I don't know why I had rheumatoid arthritis. Rheumatoid arthritis, weird lesions in the mouth, exposure to strong jet fuel fumes for 4 years, twice a week for 4 or 5 hours. At any rate, be very careful. If you're exposed to strong fumes of any kind, my advice is find out what it is. Try to be very careful with it. When you have asthma, make sure you rinse out after the inhaler. You know, I'm seeing lots of bizarre things that occurred from chemicals and or fumes that maybe happened 15, 20, 25, 30, 35, 40 years ago. I had a patient who sprayed DDT one summer. Actually for a couple of summers, he wasn't wearing a mask. He was young. This is 35 years ago. Now he's getting very bizarre symptoms in his mouth. At any rate, I just thought I'd share these interesting, unusual cases with you. So most importantly, take care of yourself. Make sure your mouth is healthy. Your body will be healthier if it is. And subscribe to our YouTube channel. We'd love to hear from you. Questions, comments. Have a great day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.